Cancerics, we have Dr. Niranjan Naik with us, who heads surgical oncology at Fortis Hospitals, Gurgaon. Dr. Naik is going to be talking about early signs and symptoms of cancer today. Over to you, Dr. Naik.
Good evening, friends. I am Dr. Niranjan Naik. I am Director Surgical Oncology at Fortis Memorial Research Institute, Gurgaon. As you all know, cancer is on the rise. There are a lot of incidences, new incidences of cancer cases are happening, and overall globally cancer is on the rise. And the best part is if we can diagnose cancer in early stage, then treatment is possible and it can be cured. So to know that, to diagnose the cancer in early stage, one should be aware of early signals of cancer, early signals of cancer or early symptoms of cancer. So if you know, then you can get it diagnosed early and get cured. So what are all the early signals of cancer? This is remembered as a mnemonic, which is known as caution, C-A-U-T-I-O-N. C for change in bowel or bladder habits. So if there is any change in bowel bladder habit, then one should consult the doctor. Like the person is developing constipation who was not constipated earlier, or he is not able to pass motion properly, or there is any difficulty in passing urine, whether there is increased frequency of urination, the possibility of going for increased urination in the night, and all these things, they may be signals of cancer. And other than that, any sore which doesn't heal, which can also be sign of cancer. Any sore which doesn't heal, it can be a sign of cancer. And any ulcer, if it is there for a long time and which is not healing, it may be a cancer. And any unusual bleeding, U for unusual bleeding or discharge from any side. Any discharge from the rectum or from vagina, any discharge from the nipple, and any bloody discharge from the nose can be a cancer. And any blood in your saliva, in sputum, in the vomiting, it may be a sign of cancer. Then T for thickening or lump or in any part of the body. This is most common symptom of breast cancer. Most of the breast cancer, they present as a lump in the breast and or thickening of the skin. And if there is any thickening of skin or any lump, one should go to the doctor and get it evaluated as early as possible. Then I is for indigestion or difficulty in swallowing. If patient is having indigestion or something called dyspepsia, like a feeling of bloating, like you are having gas in the abdomen, and if you are having any difficulty in swallowing food, earlier you used to take normal diet, now you are not able to take normal diet, you may have to take liquid or soft diet. And these symptoms may be a sign of cancer, especially food pipe cancer, esophageal cancer. Then any obvious change in a wart or mole. Any person may be having a wart or mole. So if there is any recent change in the size, shape, or in the borders of the wart or mole, it may be a sign of cancer. So one should go to the doctor. And last but not the least is N. N is for nagging cough or hoarseness of voice. Any nagging cough which is there for a long time, which it may be a sign of cancer. It may be sign of lung cancer, or it may be sign of some other cancer in the middle of mediastinum. And any change in voice, hoarseness of voice, it can also be a sign of cancer. And most common cancers are breast cancer among female, breast and cervical cancer in India. And among males, it is oral, mainly upper aerodigestive, oral cancer, as well as cancer of larynx, then lung cancer. The common cause of cancer is mainly it's smoking or chewing tobacco or consumption of alcohol. So if you want a healthy life, you should avoid these things. And if you know these early symptoms, if any known person to you is having these kind of symptoms, then it is better to go to the doctor and get yourself checked. And coming to treatment related factors, there are few things which we need to focus whenever we go for cancer treatment. They are clubbed in the 4 headings: tumor factors, patient factors, treating team, and treatment goals. So mainly treatment factor depends on the stage of the disease. So first and foremost, whenever there is any diagnosis of cancer, then we first do the diagnosis. After that we go for staging workup. In staging workup we assess whether cancer has spread to any part of the body or not. And based on the stage of the disease we decide whether tumor is disease is early stage or in the medium stage or late stage. Accordingly, treatment plan is done. Then patient factors, mainly age of the patient, then general condition of the patient, whether patient has any morbidities like blood pressure, sugar, heart problem, etc. And these are all the things, they matter in the outcome of the treatment. Then other than that, positive attitude is also one of the important factor. Patient's desire to become alright, that is also one of the important factor. Then social support like family support, social support to patient is also one of the factor which determines the outcome. And last but not the least is the treatment, where you take treatment. That is one of the important factor. See, most of the time cancer treatment is a multimodality treatment and it involves chemotherapy, radiotherapy, surgery, etc. So getting treatment in a dedicated cancer center makes a difference. So at Fortis Gurgaon we have all facilities under one roof, and we have all especially surgical techniques, open, laparoscopic, robotic, all the facilities are available. So if there is any problem, definitely it can be handled in a better way in our setup. So hope you take care of your health and watch for early signals of cancer, and good luck, all the best.
Thank you so much, Dr. Nayak. Viewers, please send in your questions to us. I'm sure Dr. Nayak will be happy to answer them for you. Thank you very much once again, Dr. Nayak.